All right, let's dive into cystic fibrosis today.
Okay.
We've got some medical excerpts
Oh,
and some summaries, keywords, things like that to help us along the way.
right.
Focusing mostly on the respiratory aspects of CF.
Right.
But I think what we really want to do with this deep dive is help folks understand
Yeah,
just how complex this condition really is.
absolutely.
You know, we want to kind of go beyond just the basics that most people might know about. So cystic fibrosis, it's not just a lung disease, is it?
Right. Cystic fibrosis, or CF, as it's often called, is actually a multi-system disease.
Okay.
So it affects many different systems in the body.
So it's a bit of a domino effect then?
Yeah, you can think of it like that.
Okay.
One system gets affected, and then that can sort of trigger problems in other systems.
Okay, so it's not just about the lungs then?
No, not at all.
Okay.
For example, CF can have a huge impact on the digestive system.
Okay.
You see, the pancreas,
Mm.
which is really important for breaking down food, it doesn't function properly in people with CF.
Mm.
And this leads to something called pancreatic insufficiency.
I've heard that term before, but to
Yeah.
be honest, I don't really know what it means.
Well, you can imagine your body as a machine.
Okay.
And the pancreas is producing enzymes that help break down fats, proteins, and carbohydrates.
All right.
And with pancreatic insufficiency, that pancreas just isn't producing enough of those enzymes.
Right.
So the body has trouble absorbing those essential nutrients.
So the food's there, but the body just can't.
Exactly.
Like that.
That's exactly right.
Wow.
And this is where enzyme therapy comes in.
Okay.
So medications like Creon, for instance,
Uh-huh.
which contain those missing enzymes,
Yeah.
become really crucial for people with CF
Right.
to help their body absorb the nutrients that they need.
That makes a lot more sense now.
Good.
So we've got the lungs, we've got the pancreas being affected.
Yeah.
What other systems are we talking about here?
Well, CF can also lead to some serious liver complications. Think of the liver as a filter, constantly working to remove toxins from the body.
Right.
But in CF, that thick mucus can block the bile ducts in the liver,
Oh.
and that can lead to problems like gallstones. And in even more serious cases, cirrhosis or even liver failure.
It's unbelievable how one condition can affect
It is.
so many parts of the body.
It really is, and it can even increase your risk of getting kidney stones as well.
Kidney stones, too.
Sounds surprising, but it's true.
Seriously.
CF affects the balance of salt and water in your body,
Right.
and this can sometimes lead to kidney stones forming.
Oh, my goodness.
Yeah.
So I'm definitely getting a much clearer picture now of just how multisystemic CF really is. But since breathing is, so vital, let's kind of focus in on the respiratory impact for a second.
Okay.
One of the terms that I saw come up a lot in the medical excerpts were bronchiectasis.
Uh-huh.
Can you break that down for us in simple terms?
Sure. Well, you can think of your airways like the branches of a tree, and bronchiectasis is when those branches become damaged and widened,
Right.
almost like they've been stretched out of shape.
So instead of nice and smooth, it's bumpy and irregular.
Exactly.
Okay.
And because of that thick mucus in CF,
Mm-hmm.
those damaged airways just can't clear out that mucus effectively,
Right.
which can lead to a buildup in all sorts of problems.
Like that persistent cough that people
Yeah.
with CF often have.
Yeah,
I
exactly.
bet that's exhausting
It is.
to constantly be coughing.
That can be very tiring.
And it's not just the coughing, is it?
No, not just the coughing.
What else are we talking about?
Doctors will often hear crackling sounds in the lungs when they examine a patient.
Okay.
And that's another sign of that mucus buildup.
Uh-huh.
Then there's clubbing of the fingers and toes.
Clubbing, like literally.
Yes, literally.
Okay.
The fingertips and toes can become rounded and bulbous.
Wow.
It's a visual sign that the body is not getting enough oxygen.
Right.
And it often appears in people with severe lung damage.
Yeah, the report actually mentioned a patient needing 4 liters of oxygen
Right.
just to breathe.
Yeah.
I can't imagine
Yeah.
how difficult that must be
It is.
to live with every single day.
It's a huge challenge.
So to really understand why all of these things happen,
Mm-hmm.
we need to delve into kind of the root cause of CF, right?
Yeah.
And that's the CFTR gene.
Exactly.
So let's talk genetics.
Yeah.
The report mentioned that CF is an autosomal recessive condition.
Right.
What does that mean in simple terms?
Okay, well, you inherit 2 copies of the CSTR gene,
Okay.
one from each parent.
Uh-huh.
And if both copies of that gene are mutated,
Okay.
meaning they have a specific flaw,
Right.
then you develop CF.
Okay.
If only one copy of the gene is mutated, then you're a carrier,
Right.
meaning you don't have CF, but you could pass that mutated gene on to your children.
So both parents need to be carriers then for
Exactly.
their child to
Yeah,
have CF.
exactly. Now, this CFTR gene, it's basically a blueprint for creating a protein
Okay.
that acts like a gatekeeper in your cells.
A gatekeeper.
Yeah.
What do you mean by that?
Well, this CFTR protein regulates the movement of salt and water in and out of the cells.
Okay.
It keeps things balanced.
Right.
But when the CFTR gene is mutated,
Uh-huh.
the protein malfunctions.
Oh,
It's like the gatekeeper's asleep on the job,
I see.
and the flow of salt and water gets all messed up.
And that's what leads to that thick, sticky mucus.
Right. Instead of being thin and watery, the mucus becomes really thick and difficult to clear.
Okay.
And that causes all those problems that we've been talking about in the lungs, pancreas, liver, and other organs.
It's just incredible that a single gene
It
can have
is.
such a profound impact on the body.
It is remarkable.
So how common are these CFTR mutations?
Well, there are actually over 2,000 known mutations of the CFTR gene.
Wow.
But the most common one, called Delta 508,
Okay.
it's found in about 90% of people with CF in the UK.
90%. Wow, that's
Yeah.
much higher than I would have guessed.
It is.
Really puts into perspective how many people are affected by
right.
this condition.
Yeah.
But it's not just the thick mucus itself that causes problems, right?
Right. That's a good point.
I remember reading something about an
Yeah.
increased risk of infection.
Yeah, that's a crucial point.
Okay.
Because that thick mucus in the lungs, it creates like a breeding ground for bacteria, making people with CF much more susceptible to infections.
So you've got the mucus blocking the airways, and then
Right.
you've got bacteria just thriving in that environment.
Precisely, a double whammy.
Wow.
Yeah. And certain bacteria are particularly problematic for people with CF.
Like which ones?
Well, in childhood, Staphylococcus aureus is a common culprit.
Okay.
But as people with CF get older,
Yeah.
a much more formidable foe often emerges, Pseudomonas aeruginosa.
Pseudomonas aeruginosa. I've definitely heard that name before,
Oh.
but I don't really know much about it.
Well, it's a tough bacterium to treat,
Okay.
and it can cause chronic lung infections that can lead to further damage
Right.
and decline in lung function.
So it's like a stubborn weed that's hard to get rid of?
You could say that, yes.
Oh, goodness.
Yeah.
Are there any other bacteria that we should be aware of?
Well, there is one that's particularly worrisome, Burkholderia sinusopatia.
Burkholderia sinusopatia.
Yeah.
Okay, what makes that one so different?
Well, this bacterium is not only very difficult to treat,
Right.
but it can also make lung transplantation, which is sometimes considered as a last resort
Right.
for people with severe lung damage, impossible.
Oh, wow.
Yeah.
Okay, that definitely highlights the importance of
It does.
proactive care to try to prevent these infections
guess-
from taking hold in the first place.
Absolutely. Early intervention and ongoing management are just crucial.
So what does that proactive care look like? What kinds of things are
Yeah.
people with CF doing to stay healthy?
Well, managing CF really involves a whole team of healthcare professionals.
What do you mean by that?
I mean, we're talking doctors, nurses, respiratory therapists, dietitians, social workers, even psychologists.
That's quite a lineup.
It is. It really takes a village to address the many different aspects of this complex condition.
So it's not just about seeing a doctor once in a while. It's about
Right.
having this whole support system in place.
That's right.
And the care itself involves a variety of approaches, right?
Yes, it does.
From daily therapies to medications to nutritional support.
Uh-huh.
For example, chest physiotherapy is a vital part of daily life for many people with CF.
It is.
Chest physiotherapy. I'm not familiar with that. What does that involve?
It's all about clearing those airways.
Okay.
It involves techniques like postural drainage, where you position your body in specific ways to help drain the mucus from the lungs,
Right.
and percussion, which involves gently tapping on the chest to help loosen the mucus. And there are also breathing exercises that can help too.
I'm guessing those breathing exercises are more than just taking deep breaths.
You're right. They are specialized techniques that help open up the airways and move the mucus more effectively.
Oh, so it's like giving your lungs a bit of a workout.
Yeah, you could say that.
Okay, so chest PT is about physically helping clear the airways.
Yeah.
But what about medications?
Yeah.
I know the report mentioned nebulized medications.
Mhm.
What are those all about?
Nebulizers are devices that turn liquid medication into a fine mist that you inhale.
Okay.
And for people with CF, these nebulized medications can really be lifesavers.
Right.
Some help to thin the mucus, making it easier to cough up,
Uh-huh.
while others actually target bacterial infections directly
Okay.
to help prevent them from taking hold and causing further damage.
Sounds like nebulizers are a pretty crucial part of
They are.
daily life for many people with CF.
For many people, yes.
So we've talked about the lungs, we talked about pancreatic insufficiency, and the importance of enzyme therapy to help with digestion. Are there any other considerations
Yes.
when it comes to nutrition?
Because of those digestive challenges, people with CF often need to consume more calories than the average person
Oh, really?
just to maintain their weight and stay healthy.
Okay,
It's like their bodies are working in overtime,
I see.
and they need that extra fuel to keep up.
I can see how that would be a challenge,
Yeah.
especially for growing kids and teenagers.
Especially,
And sometimes even with a high-calorie diet, people
Yeah.
with CF might need additional help
Right.
getting the nutrients they need.
They might. And I know that the medical excerpts mentioned gastrostomy tubes
Right.
and buttons,
Yeah.
particularly for young adults. What are those all about? Well, those are ways to provide extra nutrition directly into the stomach.
Okay.
So a gastrostomy tube is a tube that's surgically placed into the stomach.
Right.
And a button is a small device that's connected to that tube and sits flush with the skin.
I see.
And these allow for supplemental feeding, basically bypassing the need for chewing and swallowing,
Wow.
which can be very helpful for people who struggle to eat enough.
It's amazing how medicine has found ways to address
It is.
these challenges
Yeah.
and help people with CF thrive.
It is. It's remarkable.
Right. From everything we've talked about so far,
Yeah,
it's clear that life with CF is demanding, to say the least.
it can be, yes.
Are there any new developments or treatments
There are.
that offer hope for the future?
There are. And that's what makes this field so exciting right now.
Okay.
There's been a lot of progress in developing medications that target the root cause of CF.
Really?
Yes.
So instead of just managing the symptoms, we're actually talking about addressing
Yes.
the underlying problem here.
That's right.
Wow. Tell me more.
These medications are called CFTR modulators.
CFTR modulators.
Yeah.
Okay.
And they work by either helping the faulty CFTR protein function better or increasing the number of CFTR proteins on the cell surface,
Uh-huh.
or even correcting the basic defect in the protein.
So they're like a personalized repair crew for the faulty protein?
You could say that.
That's fascinating.
Yeah, it's really remarkable, and the results have been pretty incredible for some people with CF.
Wow.
We're seeing improved lung function,
Really?
fewer severe respiratory infections, and an overall better quality of life.
That's fantastic.
It is. It's very encouraging.
But do these CFTR modulators work for everyone with CF?
Unfortunately, not yet.
Okay.
They're only effective for people with specific CFTR mutations.
So it depends on the
Yeah,
individual's genetic makeup.
Absolutely. That's why genetic testing is so important in CF.
Right.
By identifying the specific mutations a person has,
Yeah.
doctors can determine whether they're eligible for these new treatments or not.
Okay, that makes sense.
Yeah.
So while these CFTR modulators are a game changer for some,
They are.
there's still work to be done to find treatments that can benefit everyone with CF.
There is, absolutely. But the research in this field is moving at an incredible pace.
That's good to hear.
It is. Scientists are working tirelessly to develop new and even better CFTR modulators
Right.
that can help a wider range of people.
It's inspiring to know that there's so much dedication and hope
It is.
for the future of CF care.
It's very encouraging.
And I bet these new treatments are having a significant impact on the lives of people with CF.
They absolutely are. But while these medical advancements are crucial, it's important to remember that CF is more than just a physical condition.
Right.
It also has a huge impact on the emotional and social well-being of individuals and their families.
Yeah.
And that's something that we're going to explore in more depth
Okay.
in the next part of our deep dive.
All right. Sounds good.
Okay.
Welcome back to our deep dive into cystic fibrosis.
Yeah.
Before we move on, I wanted to touch on something you said at the end of the last part. You mentioned that CF impacts emotional and social well-being.
Right.
Can you expand on that a little bit?
Sure. Imagine living with a condition that requires daily treatments, frequent doctor's visits,
Right.
the constant awareness of potential health complications.
Yeah.
You know, it's a lot to handle, and it can understandably take a toll on your mental health.
I can only imagine
Yeah.
like that that constant vigilance
Exactly.
and uncertainty would just lead to
Yeah.
so much anxiety and stress.
That can be really challenging,
Yeah.
especially for young adults with CF.
Right.
Trying to navigate relationships, pursue their dreams and aspirations.
Yeah.
The disease can really cast a long shadow over their plans for the future.
It must be like this constant push and pull between hope and reality.
Exactly.
On the one hand, there are these amazing medical advancements offering new possibilities. But on the other hand, there's that daily struggle. It's a balancing act
of managing a really complex and unpredictable condition.
That's a great way to put it.
And it's not just the individuals with CF that are affected, right?
Yeah, not at all.
Families also go through this roller coaster of emotions.
We do.
Parents of children with CF. They often experience, I imagine, a mix of fear, guilt, anxiety, and just this deep sense of responsibility for their child's well-being.
It can be really tough.
It's a lot for any family to cope with.
It is.
It really makes me think about the importance of support systems.
Absolutely.
Not just medical support, but also emotional and psychological support.
You're absolutely right. And that's why access to therapists, support groups, mental health resources are so crucial for both individuals with CF and their families.
It's about acknowledging
it is
that emotional burden.
And providing the tools for coping and building resilience.
Exactly.
It's recognizing that mental health is just as important as physical health.
Absolutely.
When it comes to living a full and meaningful life.
It is.
Even with CF.
Yeah.
But let's shift gears a little bit.
Okay.
And go back to the medical advancements that we were discussing earlier.
Sure.
You mentioned that these CFTR modulators are personalized based on a person's specific mutations.
Yeah.
How do doctors actually figure out which mutations a person has?
That's where genetic testing comes in.
Okay.
It plays a really crucial role in diagnosing CF and guiding treatment decisions.
Okay.
It involves analyzing a person's DNA to look for those specific changes in the CFTR gene.
So it's like detective work almost.
You could say that.
You're searching for clues in the DNA to understand the root cause of the problem.
Exactly. And the technology for genetic testing has advanced so much.
Really?
In recent years.
Wow.
It's become much more accurate, faster.
That's great.
And even more affordable.
That's fantastic.
Yeah.
So how does this genetic testing work in practice?
Sure.
If someone suspects they or their child might have CF, what's the process like?
Well, it typically starts with a simple blood test.
Okay.
Or a cheek swab. And the sample is then sent to a lab.
Okay.
Where the DNA is extracted and analyzed.
And then the lab looks for those specific CFTR mutations.
Exactly. And there are different panels or tests available depending on the situation. Some tests screen for the most common CFTR mutations. While others can analyze the entire CFTR gene to look for any potential mutation.
So it's about choosing the right tool for the job depending on what information is needed.
That's right.
So who typically orders these genetic tests?
Well, it can vary depending on the circumstances. For example, if a newborn shows symptoms suggestive of CF, like a positive newborn screening test or digestive problems, a pediatrician might order the test. Or if an adult has persistent respiratory issues or difficulty conceiving, a pulmonologist or a reproductive endocrinologist might recommend genetic testing.
It sounds like there are a lot of different paths that can lead to a CF diagnosis.
That's right.
But once the diagnosis is made, then what?
Well, that's when a whole team of specialists gets involved to develop a personalized care plan. And as we discussed earlier, this plan addresses not just the physical aspects of CF, but also the emotional and social well-being of the individual and their family.
Like a holistic approach to care?
Exactly.
Considering the whole person?
It is.
Rather than just
That's right.
the disease?
Yeah.
And with all the advancements in CFTR modulators and other treatments, the outlook for people with CF
is becoming more hopeful than ever before.
It really is.
That's great to hear.
It is. It's very encouraging.
But I imagine living with a chronic condition like this, even with the best care, it can still present unique challenges and require adjustments in daily life.
It does. That's true.
And one area I imagine where adjustments often need to be made is nutrition.
That's right.
Right.
Yeah.
We talked earlier about pancreatic insufficiency and the importance of enzyme therapy to help with digestion.
Right.
But what other dietary considerations are there?
Well, because of those digestive challenges, people with CF often need to eat more calories and fat than the average person just to maintain their weight and their energy levels.
So it's not about restricting their diet.
No.
It's about making sure that they're getting enough calories and nutrients.
That's right.
That can be tough.
It can.
Especially, for kids who are picky eaters.
Or teenagers worried about their appearance.
Absolutely.
It's like this balancing act between getting enough calories and making sure that those calories are coming from.
It is, and that's where a registered dietitian who specializes in CF can be incredibly helpful.
Yeah.
They can provide personalized guidance on meal planning, recipes, and even strategies for, sneaking in those extra calories and nutrients.
So it's like having a nutrition coach in their corner, helping them navigate all the complexities of eating with CF.
It really is.
What about exercise? Is that something that people with CF need to be cautious about?
Actually, exercise is highly encouraged for people with CF.
Oh, okay.
It helps improve lung function, strengthen muscles, and it boosts overall well-being.
That's great.
It is, of course. It's important for them to talk to their doctor.
Right.
To find activities that are safe and enjoyable.
It's about finding that sweet spot.
Exactly.
Between staying active and not overdoing it.
Yeah, and there are so many different types of exercise that can be beneficial for people with CF.
Right.
From swimming, biking to yoga, dancing.
It's great that there are so many options available.
Yeah.
But even with the best care and lifestyle adjustments, I imagine that living with CF can still be emotionally challenging.
Yeah, it can be.
Are there specific strategies or resources out there that can help people cope with?
Absolutely. Seeking support from mental health professionals.
Yeah.
Joining support groups, connecting with others who understand the unique challenges of CF can make a huge difference.
It's like building a network of support.
Yeah.
Knowing that you're not alone.
Exactly.
In this journey.
That's it.
And there are online resources and communities as well, right?
There are, absolutely.
That can offer information, advice, and a sense of connection.
Yeah, they can be really valuable.
It's amazing how technology can kind of bridge those gaps.
It is.
And create a sense of community
really
for people facing similar challenges.
Yeah, especially for people who live in rural areas or might not have access to in-person support groups.
Right, right.
Yeah.
This has been so insightful.
Good, Blatt.
We've covered so much ground.
We have.
From the science of CF to the complexities of living with this condition and the incredible advancements in treatment.
Yeah.
It's clear that CF is more than just a physical condition.
It is.
It's something that affects every aspect of a person's life.
It really does.
And that's the message that I really hope our listeners take away from this deep dive.
Absolutely.
CF is complex. It's a challenging condition.
It is.
But with the right care, support, and a spirit of resilience, people with CF can live full and meaningful lives.
They absolutely can, and they do.
Welcome back to our deep dive into the world of cystic fibrosis. It's amazing how much ground we've covered.
It is.
From the genetic basis of this condition to the daily challenges and the triumphs of living with CF.
Absolutely. It's been quite a journey.
It really has.
Yeah.
As we wrap up our exploration today, I think it's important to circle back to something that we touched on earlier, and that's the emotional and social impact of CF.
Right.
We've talked about the physical aspects, we've talked about the medical advancements.
Yeah.
But what about just the emotional side of things?
Right.
What's it actually like to live with a chronic condition like this?
Yeah.
Knowing that it requires ongoing care and management.
Well, imagine living with this constant awareness that your health is different from others. It's like carrying an extra weight, both literally and figuratively. It can really lead to feelings of isolation, anxiety, and even depression.
I can only imagine. Especially when you're trying to live a normal life.
Right.
Go to school, work, have relationships, all while dealing with the demands of CF.
Yeah, exactly. And for young adults with CF,
it
can be really challenging to navigate those milestones.
Yeah.
Dating, for example, can feel really daunting.
Yeah.
How and when do you disclose your condition?
Right.
Will potential partners understand the complexities of CF?
Exactly.
These are real concerns that many young people with CF face.
It's like there's this added layer of complexity
It is.
to an already
It
complex
does.
stage of life.
That's right.
And then there's also the issue of career aspirations.
Oh.
Some people with CF
Yeah.
might worry about whether they'll be able to handle the physical demands of certain jobs, or whether their health will hold them back from pursuing their passions.
Absolutely.
It's like they're constantly having to consider
They are.
how CF might impact their choices and opportunities.
Yeah, but I imagine with all the advancements in treatment
Right.
and the increasing life expectancy for people with CF, some of those concerns might be easing.
Yeah, there's definitely a lot more hope and optimism now than there was even a decade ago.
Yeah.
But it's still important to acknowledge
It is.
the emotional toll that CF can take.
It is.
Even with the best medical care.
Absolutely. And that's where support systems really come in.
Right. Having a strong network of family, friends, and healthcare professionals who understand the challenges of CF can make a world of difference.
It can, absolutely.
It's like having this team of cheerleaders in your corner, encouraging you, listening to you, helping you navigate those ups and downs.
Absolutely.
And support groups can be particularly valuable as well.
They can,
Right.
Yeah.
Connecting with others who are going through similar experiences can help reduce those feelings of isolation.
Provide a sense of community.
It does.
And shared understanding.
It really does.
It's like realizing that you're not alone in this.
That's right.
And it's not just about sharing your struggles either.
Yeah.
It's also about celebrating your victories.
Absolutely.
Big or small.
Big or small, yeah.
Those victories can be anything from successfully managing a lung infection to achieving a personal goal.
Right.
Or just simply having a good day.
Exactly.
It's about recognizing that even amidst the challenges, there's still joy and meaning
there is
to be found in life.
Absolutely.
So while CF presents undeniable challenges, it doesn't have to define a person's entire life.
No, it doesn't.
It's about finding ways to adapt, cope, and thrive, even with
That's right.
the complexities of this condition.
Yeah, and it's about recognizing the strength and resilience of people living with CF.
Yeah.
They are constantly adapting to new treatments.
Right. Managing their health, pursuing their dreams,
Right.
all while facing these unique obstacles that most people can't even imagine.
It's truly inspiring to witness
It is.
their determination and spirit.
It is.
But it also makes me think about the families.
Yeah.
We talked earlier about the emotional toll on parents of children with CF.
It can be tough.
What kinds of support are available for them?
That's a great question.
Yeah.
There are support groups specifically for parents of children with CF.
Okay.
Where they can connect with others who understand those unique challenges of parenting a child with a chronic illness.
It's like having that safe space.
It is.
To share their fears, their frustrations, and their hopes without judgment.
Exactly. And those connections can be incredibly validating and empowering.
Sometimes just a simple conversation with someone who gets it
Absolutely.
can make you feel less alone and more capable of handling whatever comes your way.
Yeah, absolutely. And it's not just about emotional support.
Right.
It's also about practical advice. Parents can learn from each other's experiences.
Right.
Share tips on managing treatments. Get ideas for how to advocate for their child's needs.
So it's like a blend of emotional support and practical know-how.
It is.
All rolled into one.
Exactly. And there are also resources available to help families navigate the financial and logistical challenges of CFF.
Yeah.
Organizations like the Cystic Fibrosis Foundation, for instance. They offer financial assistance programs, educational materials, and even advocacy support.
It's like having this whole team of people rallying around these families.
It is.
Helping them access the resources and support they need.
Absolutely. It's a real team effort.
To thrive.
It is.
This deep dive has been incredibly eye-opening.
Good. I'm glad to hear that.
We've explored the science, the treatments.
The emotional and social impact.
Yeah.
And just the incredible resilience of the CF community.
It is remarkable.
It's a reminder that behind all the medical jargon and the statistics, there are real people living full and meaningful lives. with this condition.
Absolutely.
Well said. And while CF presents undeniable challenges, it's also a story of hope.
It is.
Innovation and just the unwavering human spirit.
That's right.
Thanks for joining us on this deep dive.
Yeah, thanks for having me.
Into the world of cystic fibrosis. We hope you've gained a deeper understanding of this complex condition and the incredible people who live with it every day.
It's an amazing community.
And we encourage you to continue learning, exploring, and supporting the CF community in whatever way you can.
Absolutely.
Until next time, stay curious.